Healthcare providers. Don't let legacy vendor relationships become your practice's biggest liability. The Glens Falls Hospital incident reveals a critical truth about healthcare cybersecurity that every practice owner needs to understand.
Here's the timeline that should terrify every healthcare leader. November 2nd, 2024, Glens Falls Hospital terminates their Oracle Health Cerner contract. January 22nd, 2025, hackers breach Oracle's legacy servers containing Glens Falls patient data. The attackers accessed legacy systems. February 20th, 2025, Oracle detects the breach. June 6th, 2025, Glens Falls Hospital finally receives the affected patient list.
Devastating reality? Patient data was compromised almost 3 months after the hospital thought they were safely disconnected from Oracle. Let's discuss what went wrong.
The list of failures starts with legacy data still sitting on migration-pending servers. We'll walk through the key failures.
By the end of this video, you'll know exactly what to audit, what to demand from former vendors, and the steps to protect your patients and your practice.
This isn't hypothetical. It's a blueprint for risk in every practice that treats vendor termination casually.
Here's what went wrong.
Data remained sitting on legacy servers pending migration for months. You need a clear data deletion process, with timelines, tracking, and accountability. Most providers assume deletion occurs after a contract termination. However, an assumption is not verification. You must have documented vendor termination procedures that include verification.
Canceling access doesn't equal erasing data. It just means account access is denied.
Missing these critical steps creates a substantial ongoing risk. Never assume that contract termination equals compliant data destruction. Attackers exploit whatever data remains accessible. The Glens Falls Hospital thought they were disconnected. They weren't. When no verified deletion certificate is delivered, you are still liable for that data's existence if that data exists and gets exploited. You are on the hook for the damages and fines. Glens Falls Hospital patients are now receiving 24 months of credit monitoring, the least of the downstream cost of poor vendor termination. If you think vendor termination is a paperwork task, you're exposing patients and your practice.
The compromised data included everything hackers dream of.
Patient names and social security numbers, medical record numbers and diagnoses, medications and test results, medical images and treatment information, physician names and medical details.
That's the data attackers can monetize. Identity theft, targeted scams, extortion.
Once exfiltrated, data circulates quickly. Financial and reputational damage follows. Patients are directly harmed, from identity theft to disruptions in care.
This is why legacy vendor data cannot be ignored. Right now, you might have legacy data sitting on old vendor servers that you think are safe.
Contract termination data security. Your patient's PHI could be vulnerable months or years after you've moved to a new system.
The hard truth. Most practices treat vendor relationships like gym memberships. Cancel the contract and walk away.
That casual approach is dangerous in healthcare. The cost of prevention is always less than the cost of breach response. Regulatory exposure, audits, fines, and patient notification costs add up. Glens Falls patients got 24 months of credit monitoring, a tangible downstream cost. Ask yourself these critical questions. When did you last audit your former vendor relationships? Do you have verified data deletion certificates from previous EHR vendors? Are you confident that all your patient data has been properly migrated? Do you have a documented vendor termination protocol?
If you can't answer yes to all of these, you could be the next Glens Falls Hospital.
This is why vendor relationship termination requires a HIPAA compliance expert, not just IT support.
A proper HIPAA-compliant vendor termination includes
complete data inventory and mapping, verified data deletion with certificates, legacy system security assessment, business associate agreement termination protocols, ongoing monitoring for dormant data exposure, documentation for compliance audits. Demand a signed time-stamped deletion certificate, not an email. Conduct a legacy system security assessment before you declare the account closed. Ensure BAAs are formally terminated with documented responsibilities. Put ongoing monitoring in place to detect dormant exposures. Keep thorough documentation for audits and incident response.
the bottom line. The cost of prevention is always less than the cost of breach response. Are you sure your old vendor data is secure? If this made you uncomfortable, that's the wake-up call you needed. Audit now and consult a HIPAA compliance expert.